Introduce the next speaker. The next speaker is Dr. Alok Sharma. Dr. Sharma is a neurosurgeon and neuroscientist who presently is the director of NeuroGen Brain and Spine Institute at Navi Mumbai and KLS Institute of Anti-Aging, both in Navi Mumbai, India. He was professor and head of Department of Neurosurgery in the LTMG Hospital and Medical College, Mumbai from 1998 to 2023. He has published over 173 scientific publications, authored 24 books, contributed chapters to many textbooks. He has made over 200 scientific presentations at international, national, and zonal conferences and meetings, and has organized and arranged over 25 national and international conference workshops in various specialized areas of neurosurgery. He is the president of the Society of Regenerative Sciences, India, and vice president of the International Association of Neurosurgery. He is pioneer of cell therapy and neurological disorders. His landmark accomplishments include the publication of the world's first scientific paper on the role of cellular therapy in autism. He has also published the world's first paper on cell therapy and intellectual disability. He has revolutionized the management of neurodevelopmental disorders with his innovation combination of cellular and integrative therapies. He has been the recipient of several international and national awards, such as the Rose of Paracelsus Award from EMA Oxford 2016, the European Award for Best Practices, Brussels 2018, the Bharat Gaurav Award, London 2019, the Newton Universal Legendary Award, Boston 2022, the Sinophil Asia International Peace Award, Manila 2023, and the Nelson Mandela Leadership Award, Oxford, UK 2023. He has set up India's first dedicated anti-aging institute in Navi Mumbai. During the COVID-19 pandemic, he did original research on the use of stem cells and ozone therapy in COVID-19, and has published 4 papers and 2 books on COVID-19. With all of that, I would like to introduce Dr. Sharma as the next speaker.
Good morning, everybody. What a unique pleasure, privilege, and honor it is to be standing on the dais just after the legendary Temple Grandin spoke here. I mean, this is a privilege that I can't even describe. A lot of what she's spoken about is going to be reinforced by what I'm going to speak. Like she mentioned, different people have different skill sets and they do what they are best at. I'm a neuroscientist and a neurosurgeon. As a neuroscientist, my job is to get behind what is happening. What's the science behind what's happening? And as a neurosurgeon, I've been trained to fix it. Just like people fix motorcycles, cars and aircraft, well, my basic training is to fix what's wrong with the brain. And my whole life I've done conventional neurosurgery till I developed interest in the field of regenerative medicine. So it's a real privilege and pleasure to be here. So my talk will have 3 components. The first, I'm going to talk about the new attention on autism. And this has happened in the last 3 months. People at the highest level, both in politics and business, are now talking about autism that we had never seen or heard before. The second part of my talk will be the science. And this science is data. In the field of autism, there are, of course, several opinions, views, some of them very passionately and strongly held. But as a scientist, I'm going to present raw data. And this is data that we have studied ourselves. This is data that is published, most of it is published in peer-reviewed scientific journals, and some of it is work in progress. And the next part will be, what are the new strategies in the management of autism? So what is the new attention on autism? First, we have the President of the United States and the new, Health Secretary of the United States talking of autism. This is something we've never seen before. We've never had a president talk on autism, but President Donald Trump on 3 different occasions including the video you see, which was in the Congress, is talking about autism. And then we have the two, biggest business people from the country that Temple spoke about, also talking on autism.
Our goal is to get toxins out of our environment, poisons out of our food supply, and keep our children healthy and strong. As an example, not long ago, and you can't even believe these numbers, 1 in 10,000 children had autism, 1 in 10,000, and now it's 1 in 36. There's something wrong, 1 in 36, think of that. So we're going to find out what it is.
So that's the President of the United States talking in the US Congress on autism. And this is not the first time. He spoke about it in an interview on television. He spoke about it when RFK Jr. was made the health secretary. It's the third time he's talking about this.
The ASD prevalence rate in 8-year-olds is now 1 in 31. Shocking. There's an extreme risk for boys. Overall, the risk for boys of getting an autism diagnosis in this country is now 1 in 20. And as high in California, which has the best data collection. So it probably also reflects the national trend, 1 in 12.5 boys. This is part of an unrelenting upward trend. The prevalence 2 years ago was 1 in 36. Since the first ADDM report in 1990, which was 1992 births, autism has increased by a factor of 4.8. That's 480%, I believe. The first ADDM survey was 22 years ago when prevalence was 1 in 150 children. In all the core states, the trend is consistently upward, and most cases now are severe. So about 25% of the kids who are diagnosed with autism are nonverbal, non-toilet trained, and have other stereotypical features, head banging, tactile and light sensitivities, stimming, toe walking.
So that was the Secretary Health of the United States of America, his first press interview after he became secretary. And what did he speak about? The increasing incidence of autism. So that is now the new focus when the President of the United States and the Secretary Health are talking about autism. And now we'll see what the business people are talking about. Temple spoke about Bill Gates, and here's a short clip of the video he gave.
You talked about that if you were a kid today, you would probably have a diagnosis of autism. What makes you think that?
Well, the term, particularly when they say on the spectrum, that's gone from being a narrow, very narrow thing to now pretty broad. And I was very slow to develop socially. I kind of rock. I concentrate intensely. My teachers were so confused that in the same grade they said put him ahead 1 or 2 grades, and another teacher said push him back 1 or 2 grades. So that was a dilemma. My energy, my obsessions, fortunately, writing software being one of those, so that worked out well for me, marked me out as a very different kid in terms of my neurological style.
Your ability to focus as a kid and solve problems in your head, I mean, that you write about, it became kind of a superpower.
Absolutely. I wouldn't trade it despite the other limitations that it came with.
So that's interesting because Bill Gates has never spoken about this before. And, recently he actually wrote that in the book, and this is his TV interview.
I'm actually making history tonight as the first person with Asperger's to host SNL. Or at least the first to admit it.
So there again, Elon Musk talking about it as Asperger's. So the nomenclature, the approach, the attitude for autism has changed from being considered a psychiatric disorder, disability, to being a spectrum disorder, to neurodiversity. And what we heard in the lectures yesterday, we had autism being referred to as neuro-unique, and in a wonderful talk yesterday about it being the future of human evolution. So a lot has shifted in the recent few decades. We can go back and forth on this, but there's a small movie clip from a movie called The Accountant, which I think very beautifully describes everything that summarizes all of this.
He was just like our other two. He was a happy baby. Now he rarely speaks. It's like our child is missing. He's not there. He's lost and he needs our help. We
hoped that he would catch back up, but he didn't. 1 in 68 children in this country are diagnosed with a form of autism. But if you can put aside for a moment what your pediatrician and all the other NTs have said about your son. What NTs? Neurotypicals. The rest of us. What if we're wrong? What if we've been using the wrong tests to quantify intelligence in children with autism? Your son's not less than. He's different. Now your expectations for your son may change over time. They might include marriage, children, self-sufficiency, and they might not. But I guarantee you, if we let the world set expectations for our children, they'll start low and they'll stay there. Maybe your son's capable of much more than we know. And maybe, just maybe, he doesn't understand how to tell us. Or we haven't yet learned how to listen.
So this video in a very concise way summarizes everything that we need to understand about autism. So now comes my part, the scientist. So what I'm going to now present to you is the science that we have uncovered over the last 16 years, having treated over 6,000 children on the spectrum. And we are going to look at everything, what's happening in the brain, what's happening in the blood, what's happening genetically, and what's happening in the gut. So we're going to look at the neuroimaging findings, which give us a lot of information. We're going to look at what's happening within the blood. We're going to look at the genetics as well as the gut. So the first thing is, these are two brain scans. On the left-hand side is something called a PET-CT scan. This is a functional scan, which shows you how the brain is functioning either normally, hypometabolic, or hypermetabolic. And then there is the MRI scan. So let's look at the PET-CT scan. So we've done PET-CT scans in over 6,000 children on the spectrum, and this work is published in the World Journal of Nuclear Medicine. Everything I'm going to talk about is published in peer-reviewed scientific journals. In this paper, which for almost the very first time identifies which parts of the brain in these children are hypometabolic and which are hypermetabolic. So we found actually that the cerebellum, which is the main processor of the brain, is called the autopilot of the brain. In every single child on the spectrum, the cerebellum is hypometabolic. The other areas are the amygdala, hippocampus, the parahippocampal gyrus, caudate nucleus, mesial temporal lobe, thalamus, and the superior and middle temporal lobe. So we found that all these areas are hypometabolic. This reinforces the fact that children and adults on the spectrum are slow processors, exactly like what Temple said, because the main processing, the CPU of the brain, is the cerebellum. And in every child on the spectrum, the cerebellum is hypometabolic. In every child, 6,000 scans we have. But there is some very interesting news as well. We've also found that there are parts of the brain that are hypermetabolic or working more. In particular, the parieto-occipital lobe or the visual spatial areas, they are hypermetabolic. So the cerebellum, which is blue in color, is hypo, working less. Green is the normal brain, and the yellow and the red is brain that's working more. This explains why kids on the spectrum are visual thinkers, because their brain, the occipital, the visual lobe, is hypermetabolic. In every single child, 6,000 kids on the spectrum, the occipital lobe is hypermetabolic. So they see differently. That's why they're visual thinkers. That's why they're able to do all the things. And in the high-functioning children, we also have the frontal lobes, which are hypermetabolic. So the shift in focus in neuroscience is earlier it was what they can't do, and now when we look at the science, we are looking at what they can do. This is today explaining what is happening with our children. It reinforces almost everything that Temple has said. But this is the science. This is the brain scans, and I'm showing you one or two. We have over 6,000 of these. So mainly the parieto-occipital lobe and these other areas. However, what we have found from our data, and this is published in our paper, the brain functioning gradually decreases over the years. This is from our published paper in the different parts. This is what our work showed us, that children on the spectrum, their SUV brain functioning is higher and then gradually decreases. In neurotypical people, it increases. But there's something very interesting in this data. The fact is that children on the spectrum start higher than neurotypical people. That was the most amazing finding. Their brains are functioning more earlier on. And then there is a slight decline, whereas neurotypical start lesser and then go up. When you intervene early, you are able to bridge this gap. Now we look at the MRI study. Again, this work is published in this paper, where we have found that the corpus callosum is the bridge that connects the left and the right side of the brain. We've published this in this paper. This bridge is smaller in size and volume. So we've compared this to neurotypical or normal people. So the bridge is smaller in volume. This is because of the small size, the connectivity between the right and the left brain is lesser than that it is in neurotypical people. So then we have gene mutation, and what we found is there is a gene, it's called the MTHFR gene, the methyl tetrahydrofolate reductase gene. What does this gene do? It converts folic acid. This is vitamin B9. I want you to understand this because this is very important. We take folic acid in a synthetic form which is inactive and unusable. This is how we take folic acid. However, in the body, there is a gene which controls an enzyme that converts it into an active form, which is methyl tetrahydrofolate. So folic acid has to be converted into MTHF for the brain to absorb it. All right. Now, what we have found from our own data is that in a significant amount of children with autism, there is a mutation of this gene. So the folic acid, which is inactive, cannot convert into the active form of NTHF. And because it cannot convert, it results in a cerebrate folate deficiency. Our data shows us that 73% of the children we have studied have this mutation, which means we are giving them folic acid, their body is not able to, their brain is not able to absorb it. So this is important because this is easily preventable. We have to give it in an active form rather than the conventional inactive form. Now we look at CSF neurotransmitters and amino acids. So we are among the only institute, very few centers have actually studied what's happening in the CSF or the cerebrospinal fluid. And we've got some very interesting data. We found the dopamine, glutamate, norepinephrine, threonine, tyrosine, methionine, all these are low, and serine, tryptophan, isoleucine, ornithine, and proline are all high. The low levels of dopamine, the low levels of glutamate, norepinephrine, and these are all the various neurotransmitters. Important one is serotonin. These are low in the CSF. Now we look at the blood neurotransmitters, and here again we find that there are low levels of phenethylamine, tyrosine, dopamine, and GABA, and high levels of serotonin and glutamate. Here's the interesting thing. If you summarize it, you can see glutamate is high in the blood, but low in the CSF. Serotonin is high in the blood and low in the CSF, whereas dopamine is low in both. This is very interesting because sometimes people look at the serotonin in the blood and say that serotonin is high. What we are finding is it's high in the blood because it's not getting into the CSF or into the brain. So this is all very interesting data, which is now pointing towards what really is happening in the brain. This is the science behind what is happening in the brains of somebody on the spectrum. Then blood vitamin levels. So we found low vitamin D in 46% of our children. But 81% of our children, folic acid is high. We are supplementing our children, giving them folic acid when they already have higher folic acid levels. This is again very interesting. This is our data. So it's very important that we don't give folic acid as folic acid, but we give it in its active form. The gut microbiome testing, again here we have interesting data. We found that 47% of our children have E. coli, 59% have Shigella, there are fungal infections, protozoal infections. So we are finding a lot of infections in the gut. These also need to be corrected. So it's important that the gut dysbiosis is corrected because there is a direct connection between the gut and the brain. 70% of the kids have a significant gut issue. There is a big debate about the cause, including what the health secretary, RKF Jr. is talking about. So there are multiple causes. There are environmental factors, there are patient and family-related factors, and I'm not going to go into the details of all this: exposure to chemicals, electromagnetic radiation, heavy metal, vaccines, use of medications early, older age of parents, nutritional deficiencies, health status of the mother, stressful life, and genetic factors. But I'm going to go to our data. What is our data? What we found is 50%, little more than 50% of the kids on the spectrum had some birth hypoxia, some birth complication, premature birth, something or the other at birth. So this is 50%. That's a very high number. Also, the hypometabolic area is actually now in 6,200 patients, or 100% had, this is the posterior circulation, the vertebrobasilar territory. So we all are aware that birth hypoxia causes cerebral palsy. In cerebral palsy, we note that the anterior circulation is affected. That's why they have motor problems. They have difficulty in walking, spasticity. In autism, we are finding posterior circulation territory. There is vascular. So there could be a connection with the fact that 50% have this history and the area shows vascular territory. Also, our data shows that 73% of the kids have this gene mutation and 81% have high folic acid. Those who have this gene mutation cannot convert folic acid to active methylfolate, and so they have high folic acid levels. Now here's something very interesting, very interesting. In 1998, two things happened. WHO gave guidelines to suggest folic acid supplementation in a dose of 0.4 milligram per day for the first trimester for mothers. This was to prevent neural tube defects, and it did a wonderful job. I remember as a student in the 1970s, 80s, when I was a neurosurgery student, we had a very high incidence of neural tube defects. These are meningomyelocele. There's a problem in the spine. Now, correcting the folic acid has reduced that dramatically. However, something else has happened. Now, the other thing was, around the same time, in the United States, there was mandatory folic acid fortification of cereals like maize and wheat. Two things happening in 1998. All right. And then look at this. 1970, 1 in 10,000. 1995, now these are not our figures, these are US CDC figures. 1 in 1995. Suddenly, you notice a massive spurt here. Okay. After this, it just goes on and on and on and on, and now it is 1 in 31. So around this time, the folic acid supplementation of food and mothers happened. Of course, around this time, multiple other things happened. There was a greater use of mobile phones. There was, the MMR vaccine. There's so much that happened around this time, and this accounts for this increase. But I'm just talking about our data and our science. So, this is important to understand. Now, what is new in the management of autism? Like I said, I'm a neurosurgeon. I like to fix things. So, I believe that the management of autism will require 4 pillars. One is rehab is important but comprehensive. We will have to use cellular therapy to fix whatever is the damage in the brain. We'll need to supplement the nutrients and integrative therapies. So the old belief was, when I was a student, medical student, when I was a neurosurgery student, it was believed the central nervous system cannot regenerate. But now the thinking has changed. Some regeneration is possible through a process of repair, of cellular replacement and repair. So what exactly are cells or stem cells? The word stem cell comes from the stem of a tree. And just like the stem of a tree gives rise to branches, leaves, fruits, etc., there are some cells which can give rise to all cells of the body. So basically, cell therapy or regenerative medicine is you use healthy cells to replace the damaged cells. So this is a scan of a child with autism. The blue is the hypometabolic area. When you give stem cells, the damage gets fixed. This is the X-ray of a leg with a fracture. You can see the fracture. I ask you, if anybody had this fracture, would we give physiotherapy or rehabilitation on a broken bone? Would anybody do that? No. You would get it fixed by an orthopedic surgeon, and then you would give physiotherapy on this. But this is exactly what we are doing with our children. Here is the brain, and we've got 6,000 scans. that show that the cerebellum and the medial temporal areas are hypometabolic. And we are giving rehabilitation on this brain that's not functioning adequately. Obviously, we won't get the results that we want, all right? But if you fix it, and it's possible to, you can see this is the same patient, you can see that there is activity in the cerebellum now, there's activity in the mesial temporal areas. When you give rehabilitation on this, you obviously get better results. So I just like to show this. When I was in my student days, if I had to take a video, I need a video camera. For still pictures, a still camera. I need a computer to type work. For music, I listen to I needed this. I had this for a telephone, for a calculator, for television, torch. And now what has happened to all of this? Somebody told me in the 1970s that one day all this will be in the palm of your hand. It would be science fiction, right? Okay, but it's happened. All of this is now in the palm of a hand. The same thing is happening in the field of medicine. If somebody as a student told me that one day modifying the immune system, neurogenesis, preventing cellular death, releasing trophic factors, improving myelination, improving blood supply could all happen with a single cell, it would be science fiction. But it is happening. And cells or stem cells are able to do that. Now worldwide, if you see, there are over 290 publications on the use of cellular therapy in neurological disorders. You can also use them in orthopedic, wound healing, cardiac, etc. And in autism, there are 33 international papers, in cerebral palsy 44, and these are other neurological conditions. One of our Bibles or Gita or Quran in medicine is a book called Harrison's Principle of Internal Medicine, and in that there is a chapter on regenerative medicine, and it talks of many neurological conditions that can be treated. The Nobel Prize, which is the highest recognition in medicine, 3 times in a 15-year period has gone to stem cell regenerative research. 1990 to stem cells in bone marrow, which is what we use. 2007 to embryonic stem cells, and in 2020 to what are called iPSC cells. Here is one of the world's greatest scientists, Stephen Hawking.
I have spent my life
this is his views on stem cells.
The mysteries of the cosmos. But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us,
which have special powers. They are called stem cells.
So one of the greatest living, he's not living anymore, who had ALS actually, and he did a 10-part TV series on stem cells. So how do stem cells work? First, they have the ability to multiply. Second, they can convert into any cell type. This is the most important thing. The same stem cell can become a nerve cell, a heart cell, or a muscle cell. They improve the blood supply and they release certain positive chemicals called growth factors, because of which they can repair, regenerate, and replace damaged tissue. This is just to show you the medical action, the paracrine effect, the anti-apoptotic effect, the neuroprotective effect. So this is the way stem cells work. They have an anti-inflammatory action. Cells are of 2 types. They could be autologous. You can take them from your own body and put it back into the own body, or they could be allogenic, where you take it from a donor. There are different types. There are cells which are embryonic stem cells. We don't use these because these are controversial. You could get them from the umbilical cord. We don't use these as well. We prefer to use cells from the own body, which is from the bone marrow, because it's very easy to get these. So we do not use embryonic stem cells, and we use cells from our own body. We chose to work with adult stem cells because they are safe, they don't form tumors, they don't get rejected. You can get them from a single needle prick, and there are no ethical issues. The way you inject them back is you can inject it into the lower back through an injection called lumbar puncture into the CSF, where it goes straight to the brain. This is our preferred method. You could also give them intravenously, intramuscularly, intraarterially, through the nose, or directly into the brain. The procedure is very simple. It's a 3-step thing. We do a bone marrow aspiration from the pelvic bone. Over here, it's a 15-minute procedure. These are taken to the laboratory. The cells are separated out that we want, and through a simple needle, we inject it into the lower back. So the whole procedure has 2 needle pricks. With one we take out, and with one we inject. And we are putting the child's own cells back into the child. So there is no need for any surgery or nothing from the outside. So this is how it is done. You can see the bone marrow aspiration. We take it to the laboratory. And we separate the cells through a simple needle into the lumbar spine. The cells are injected. So just 2 needle pricks. Now, I'll present our published clinical data on cell therapy in autism. We wrote the world's first scientific paper on cell therapy in autism. The second paper came from China, the third from Italy, fourth and fifth from the United States, and then from other countries like Vietnam, Iran, etc. So this is the world's first paper. We published it in 2014. Autologous bone marrow cells, an open-label proof of concept study. It was a small study, 32 patients. We had 91% of our patients improving, and they improved in various symptoms, which is, social relationships, emotional. This is the percentage of improvements: speech, language, behavioral problems, sensory issues, hyperactivity, attention, eye contact. So this is the percentage improvement in all our patients. Next paper was published in a prestigious journal, the American Journal of Stem Cells. And here again we, presented our data. And this data was a little bigger, 254 patients. 95% of the patients improved. Again, you can see social interaction, eye contact, attention, stereotypical behavior, aggressiveness, hyperactivity, self-injurious behavior, sitting tolerance, command following speech, all of them improved to these percentages as shown above. Now here's something interesting. We found that the improvements are age dependent. So between 0 to 5 years, we had a 97% success rate. With 5 to 10, it dropped to 94, then again 94, and 15 and above, it was 91%. So the results are dependent on age. The earlier we intervene, the better results we get. An objective improvement, so here again, so this is we do a PET scan. There are 2 types of machines, a Siemens and a General Electric. These pictures are from the Siemens machine. You can see the hypometabolic area before, and 6 months later, you can see the hypometabolism is gone. For the first time, we showed the world that the hypometabolic or non-functioning areas in the children on the spectrum can be reversed. And we don't have 1 or 2 of these. Like I said, we have 6,000 with a 90% success rate. This is the same data on a GE machine. That's why they look different. Again, you can see the hypometabolic area, and you can see that it has improved. This is our next paper, which is in preprint now, and this is data from 1,111 patients. Again, here you can see similar improvement in all these symptoms. Similar kind of data. These are the scores. We have an Indian score for autism and the CAR score, and you can see the percentage improvement. I just have to run through it for want of time because otherwise I would have gone into some detail. So everything from social relationships, speech, behavior, all these improve, and these are all statistically significant. This is a pre-mean score, post-mean score, and in all parameters there's a statistical significance. In this larger paper, these are the results. Between 0 to 5, 89% improved. Between 5 to 10, 87, 84, 80. This is a larger study, but this is our data from the larger study. And again, you can see the hypometabolic areas have become functional. What I showed you was data we published. This is a worldwide review. Just I'll quickly run through it. So this is the paper that I presented, our world's first paper. We showed 91% success rate. This paper was from China. Again, here there was an 88% success rate. I'm just running through it fast. The paper from the United States, Dawson et al., 90% success rate. This paper from Kimberly in the United States, 90% success rate. This paper from Martinez in Mexico, 95% success rate. This paper from Vietnam, 93% success rate. This paper from Italy, this showed the lowest, this showed a 78% success rate. So these are published studies worldwide. And then there's something called meta-analysis or systemic review, which analyzes data from multiple papers and studies. And this is the meta-analysis done by Martinez in Mexico. This included a study of 461 patients. Their conclusion was that it is safe, it improves patients clinically regardless of cell source, and there were significant improvement on all the scales. This was another meta-analysis by Jiang Q et al., 325 patients. Again, they said it is safe and effective. So those are called meta-analysis. So that was the cell therapy part. The next part of the treatment is neuro-rehab. I won't go into the details because you all are familiar. But what I want you to know is the brain is hardware and software. Cell therapy only improves the hardware. The software comes from therapies. Without therapies, you will not see improvement. So whereas the stem cells will repair the hardware, rehab and teaching at home, we believe that the best rehabilitation happens at home. That is what will teach this brain what to do. So we all are familiar with comprehensive rehab. I won't go into details. They are the regular and new. These are the rehab facilities at our hospital. But one rehab I'd like to stress on is aquatic therapy. It's not used so often. We found amazing results with aquatic therapy. Aquatic therapy is not swimming. Aquatic therapy is therapy in water. It requires a trained therapist, and we find tremendous improvements with aquatic therapy. So rehabilitation enhances the results of our cell therapy in various ways by promoting cell integration, survival, and neural connectivity. And the last part of my talk is integrative therapies. These include hyperbaric oxygen, HbO2, ozone therapy, and gut cleansing. What is hyperbaric oxygen? Basically, hyperbaric oxygen is giving 100% oxygen under pressure. And these are all the benefits that are listed. This is the chamber that we have. And, the parent can go very comfortably inside. Each session lasts for about an hour. How does HbO2 work? This we need to understand. See, this, right now, all of us are breathing oxygen at 1 atmosphere pressure. 1. At 1 atmosphere pressure, so our blood has got red blood cells, white blood cells, platelets, and it's got this liquid called plasma. So right now in all of us, the oxygen we breathe is being carried only by the hemoglobin in the red blood cell. There is no oxygen in the liquid, all right? But when oxygen is given under pressure, the oxygen goes into the entire liquid. Now the entire liquid or plasma is carrying oxygen. So much more oxygen goes into the brain, and we found a tremendous improvement with this here. My friend and colleague, Titler Saxton, are you here? So we have the president of the American Association of Hyperbaric Oxygen sitting with us. Thank you. He's the one who's helped us, trained our people into hyperbaric. Thank you so much. Then there is ozone therapy. Ozone is actually, oxygen is O2, ozone is O3. It also has tremendous improvement in improving oxygenation, lowering inflammation, improving gut health, releasing growth hormones, etc. The way we give ozone is we can give it through the ear, we give it rectally, and we do ozone cupping, which helps in improvement in speech. Now what we have found is that HbO2 and ozone work together much better. So what ozone does is it enhances the cellular oxygen utilization. HbO2 enhances its delivery. So our experience is that these both work in tandem. Most places give either HbO2 or ozone. We believe giving it together has a positive effect. This is just to show you the benefits of giving both together, improving the immune system, neuroprotection, and repair. So this is the benefit of both. Next is the gut. So what we do is we do a gut microbiome test. We identify the pathogens in the gut. Then we clean the gut through rectal ozone, and then we restore the gut balance through dietary recommendations. There is an elaborate mechanism. The gut microbiome test, it's a very detailed, it's a 20-page report. It tells you what infection is there. Is it fungal, viral, protozoal? And then we correct that, and then using pre and postbiotics and ozone, we clean the gut. We believe this is a very important part of the management. By removing the toxins from the digestive system, there is a significant enhancement of the improvements. We also focus, of course, on diet that we're all familiar with. Gluten-free diet, foods to eat, not to eat. We're all familiar with that probiotics, prebiotics, ketogenic, gluten-free, casein-free is good. And foods to avoid, obviously, are sugars, additives, and pesticides, etc. And we all are aware of a ketogenic diet. I won't go into the details. Micronutrient supplementation. So this is our, again, experience. We find that vitamin D is deficient in a lot, and it needs to be supplemented. Vitamin D, by the way, is made by exposure to the sun. You all know that, right? All you need is exposure to the sun, and your skin manufactures vitamin D, but because in many parts of the world you don't have so much sun and people are all indoors, they aren't out. In our time when we were younger, we played outside. When we came back from home, we were outside playing. And today kids aren't doing that. And so there's no wonder they have less vitamin D. Also we need, so I told you that they have high levels of folic acid. So what we need is, instead of giving them folic acid, we need to give them folinic acid, which is a reduced form, which bypasses the blocked receptors. So if you give folic acid, which is the way it is available as a supplement, it leads to increased levels, but we need to give it as folinic acid, and when you give it as folinic acid, it then gets into the brain. So it's very important in which form and in what dose we give folic acid. Now, what we studied, so we were doing till 2019, we were doing only cell therapy. From 2019 onwards, now we combine it with integrative therapy, and then we analyzed the data. We studied 714 patients who took only cell therapy and rehab, another 700 who took the integrative, which is the oxygen-based therapies as well. And we found this difference that only cell therapy, 87% of our patients improve. When you combine it with integrative oxygen therapies, it is 91%. And these are all the symptoms you can see in every parameter. The one cell therapy with integrative is better in all the symptoms. Also, the scores are much better. And most important is the PET CT scans. This is technical data, but this also showed that when you gave cell therapy with oxygen therapy, hyperbaric, the results were better.
When we came here to NeuroGen, she was totally non-verbal. She had no speech. Immediately after the first shot of stem cell, that's when she started now having one word.
Less than 2 weeks from that, he was using single words like
C4.
Magically the water came out from the mouth, mama came out from the mouth.
Therefore,
I remember the first day she called me mom, I cried because it was so emotional.
Within about like 40 days, a remarkable improvement. Her eye contact is fabulous. She started sleeping on a time. That is wonderful.
Biggest game changer for Prithvi is his expressive language, his speech. He started speaking more. He even started telling us what's going on in school.
He's able to listen and he's able to understand more and he's able to learn new things.
So after stem cell, what I saw was he was able to read sentences in his mind.
He has improved his eye contact. If he wants water, if he can't reach, he'll come and ask, he wants water. We gained so much progress in less time.
She started responding to her name.
Is Eliana a big?
No.
Eliana is a?
Eliana is a good girl.
Then his writing has improved. He can read. Single word to sentences.
My girl finally she had speech. Please give me food. Can we go for a shopping?
Cranberry.
And orange.
Orange.
And mixed fruit.
Mixed fruit.
High five. Now he's able to put things in sentences. Let's put on our shoes. Let's go to the car. Let's go to the plane. Let's go home. You feel now, yes, you got your life back.
She improved her performance in the school. Her behavior has improved. Her understanding has improved.
There are certain things which I have never taught him. Huge improvement in academics, English language, Bengali, that's Bengali is his mother tongue, and also a little bit of Spanish. He can tell you the date 7th February 2030. What will be the day?
From special needs self-contained class into a gen ed class, he would come and say, I got 100 in math today. I was the only one who got 100 in math.
My child started showing this extraordinary education skills. He can do calculations, he can do square root, cube root. I have also tried a little bit of cos theta, tan theta, which is class 9-10 level with the options, and he has also given that.
The boy who was not responding, even if you call his name at the beginning, he is now, when someone walks into the room, he spontaneously, automatically says hi. He is able to grab and tell you to read for him, and you sit down and listen and watches and you read together. And he reads after you and he's able to write. His handwriting improved.
Now I'm not scared that he would take off and run away, because I think he goes out of the house and he knows what he wants to play. If they say it's dangerous, come back, he comes back. So that stress is reduced.
I taught him my phone number for emergency purpose. I also taught him the address. He is able to tell me full address and he is able to write it down so that if anything happens, he is able to say my phone number.
He understands emotions. If you're happy, he's happy. If you get upset, he knows you're upset. I have seen a lot of huge differences. It's like giving a second life to a child by doing the stem cell.
She could do short call on her own, but long call with support. But after the second one, she is fully trained.
हर बार stem cells से improvement है, and the improvement are permanent.
We've seen like significant improvement, hitting all his goals, and in fact we are now like figuring out what are the new kinds of challenges we need to set for him.
There are children with a special need, so they come to us and speak to her how Saisha is doing such a good.
My child has got some ability to fall back on and to make that as his career or the reason why he is here in this world.
The stem cell is a hope for a parent. You might not see the results in the same day or the same minute, but you can see faster and much better results.
He has, the two big sisters are both of them public health nurses. And mom is a nurse, and we are medical family. But we see and observe him every single day, and we ask ourselves, it's just a few more years, Abdullah King will be independent.
He was screaming, he was crying, I was trying to hold him, and we were like 45, 50 people on that bus. And so on the way back, this woman just let it go. Would you shut up? I felt like a bullet went through me. I just thought, wow. I was like, oh, and I just said, my son's autistic, he can't help it.
He would flap like that. He would walk on his tiptoes, look at the wall and be talking to the wall.
He started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards. We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Gradually seemed to improve overall. His mood, he was so much calmer. There weren't these horrible, horrific tantrums. They were decreasing, and when he would have a tantrum, I could talk him out of it. We could engage with him and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth and do it consistently. As a parent, it was very exciting.
This is the first time since his stem cell that he has gone to a regular school.
Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months. When we saw the PET scan images, the areas that were hypoactive or non-active were warm. There was activity there. That moment will always be, a memorable moment.
People say, oh, he's a different child now. He's a lot calmer. He's talking normally. He looks like he's grown up.
He'll say, Mom, I love you. And those words had never been out of his mouth before.
Stem cell therapy offers the potential for a cure. It has been a game changer.
He's actually topping his class. He was in a special school, now he's in normal school, he's getting A+, GPS of 3.8 on 4. So that's the improvement. What's the scientific base of our work? All our work is published in over 100 scientific papers. You can see 16 of them on autism, 15 on cerebral palsy, 4 on intellectual disability, etc. We have 16 papers on autism. We have written chapters on textbooks, recent advances in autism. We've written a chapter, Stem Cell Therapy. This is written by us. Another chapter in a book, Cerebral Palsy. Another book, Physical Disabilities. We have published over 18 books, treated over 15,000 patients from 103 different countries, from all the 6 continents of the planet. We have 2 dedicated hospitals that do just this work. I can see I still have a couple of minutes. So I'll just run through. We treat cerebral palsy as well, where the effect of brain damage is more on the body. Here you can see the scan on the left side. The blue is the damage. On the right side, you can see after cell therapy, the improvement. This work is also published in a scientific paper, 184 patients, and you can see the improvements. We have 15 papers on cerebral palsy. Intellectual disability. Here again, the world's first scientific paper is written by us, an open label proof of concept study, 58 patients. But here we had a control group. One group that took cell therapy and rehab, one group that took only rehab. And you can see the difference in the data. Those who took only rehab, for example, cognition improved in 17%. Cell therapy plus rehab, 55%. Same thing, remote memory, 12% versus 88%. So the orange is the improvement with just rehab. And in the other group, which took cell therapy and the same rehab, you can see dramatically different results in cognition, remote memory, problem solving, social inhibition, toilet training, command following eye contact, aggressiveness. The scores also, the film scores and IQ, they were also dramatically different in both. You can see it's much better in the cell therapy and rehab group. And we have 5 papers on intellectual disability. Now, what about safety? We've had no major adverse events, but the only risk is 3% of our children do develop epilepsy after the treatment. That's the only significant adverse event. 10% get a spinal headache, which lasts for 2 or 3 days, but no patient has deteriorated. We've never had any infection. We've published this. People only publish their good positive results. We've published a paper on seizures as an adverse event on cellular therapy. So we've put the adverse events out in the public domain as well. The ethical aspects of our work, all our work is done with permission from an oversight of a health ministry, CDSCO. The CDSCO is the equivalent of the US FDA, registered institutional ethics committee. So we have an IEC, here it's in America it's called the IRB, Institute Review Board, so all the work is done with that. So my conclusions are that the management of autism, I call it management, I don't call it treatment, I say we need to manage it, is multidisciplinary. We need all these things together. And newer imaging, unfortunately that imaging is not being done. See, what I'm surprised is, it is clear that autism is a neurological problem. There's something in the brain that's not completely okay, and nobody's even looking at that all over the world. So it's important, imagine you have a fracture of the leg and nobody does an x-ray, or you have appendicitis or something and nobody does an ultrasound, but it's not being done. So we need to image to understand what's going on. There are newer biochemical investigations, like low vitamin D is so easily correctable. If your child has high folic acid level, you can give folinic acid. So these are easily correctable. And new comprehensive multidisciplinary treatment, which we believe cell therapy, neuro rehab and integrative therapies, these are effective, they are safe. Please note, it's not a cure. It needs to be combined with conventional and comprehensive rehab. It's not a standard of care, but it's a clinical option. So this is the combination we believe in. Do neuro brain imaging, do comprehensive rehab, cell therapy, oxygen-based therapies, and supplement the micronutrients. We believe the best results happen when the parents accept the child the way the child is. There's an understanding of what's happening to the child. The whole family, when they work as a unit, we get much better results. We find having the day schedule works much better for these children. Then, of course, the cell therapy, rehab, micronutrient, and integrative therapies. There's good news. We are shortly going to be starting. We've got permission from the government of the Bahamas to start this work in the Bahamas. We are starting 1st January 2026. So all our work will be available there. I'd like to end by quoting what Mahatma Gandhi said, that to believe what has not occurred in history will not occur at all is to argue disbelief in the dignity of man. And what President Theodore Roosevelt said, it's not the critic who counts, nor the man who points out how the strong man stumbles or where the doer of deeds could have done better. The credit belongs to the man who is actually in the arena, whose face is marred by dust, sweat and blood, who strives valiantly, who errs, who comes up short again and again because there is no effort without error and shortcoming, but who does actually strive to do the deeds, who knows great enthusiasm, the great devotions, who spends himself in a worthy cause, who at best knows at the end the triumph of high performance, and who at the worst, if he fails, at least fails while daring greatly. So that his place is never with those cold, timid souls who neither know victory nor defeat. My last part is the view of the Prime Minister of India and the earlier President of the United States on stem cells. I end with this. I'm very fortunate that in a book that I've written, our Honorable Prime Minister, Sri Narendra Modi ji, has written an introduction. It's a big honor to have our Prime Minister write an introduction for a book that I've written. That is the introduction, and that is me presenting with the book. And here he is talking about stem cells.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहाँ गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
And the very last video that of previous President Bharat Obama.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
Thank you for your attention.